Good morning, everyone. And today our topic of discussion is tremor, and this one is the last physical diagnostic topic which we are going to study, and like the symptom I'm talking about, and then we are going to talk a little about the joint examination, and once we are going to finish the joint examinations lecture, then we are going to move on laboratory diagnosis. So, what is tremor? Tremors are basically um, involuntary movements, okay, involuntary rhythmic movements which occur in the body. We call them as tremor, and this is a kind of movement disorder. So, when we talk about the movement disorders, so there are most of the abnormal movement or movement disorders are basically linked to basal ganglias. Okay, so how whenever there is any problem with the or pathology with the basal ganglia, um, basically there is a misbalance in the intrinsic or you can say the indirect and direct pathway. Like for sure, to understand that we must know the functionality of basal ganglia. So what happens is there are different type of movement disorders like hemiballismus, athetosis, chorea, okay, but tremors, uh, which we define as like rhythmic movements, okay, which could be like these rhythmic movements could be in a part of a limb or in the hands or even in the head. So uh, tremors, um, what you can say, can be classified into number of what you can say based on how they look like. Either um, they are the one which is occurring during the rest, or either they are occurring during active movement. Okay, so they are classified on number like in number of ways. Like one of the classification you can see, like one is rest tremors. Okay, so what is rest tremors or resting tremors? They occur when the part is not moving. For example, if we are talking about the limbs, upper limbs, if the hands are at rest and still they have tremors or they have rhythmic movements are there, so we call them as resting tremors. Okay, one of the example you can see is Parkinsonism or Parkinson's disease. Like in these patients, they have pill rolling movements, okay, and they are usually asymmetrical. So the person may have the tremor of the head even in Parkinson's disease or Parkinsonism. We call that thing as titubation. Then there is physiological tremors. Uh, these are the most common type of tremors, physiological tremors. And if you want to know like what are physiological tremors, guys, like outstretch your hands and see like your hands are having very fine movements, okay, very 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 fine movements, and we call it as physiological tremors. And they are the frequency of the physiological tremors are like around 8 to 12 hertz. You can observe your own hands, and whenever you are in anxiety or in you are fatigued, these tremors are exaggerated, or in endocrinal condition or in response to certain drugs, okay, they can be exaggerated. Then there is one more type of tremor which are called as essential tremors, okay. So essential tremors, this is what I was talking about, the physiological tremors, okay, and this is present almost in everyone, okay. So essential tremors, uh, like they resemble physiological tremor, but essential tremors are basically inherited disorders which run in some families. And what happens, uh, they have the tremors when they are trying to do some movement. For example, if you are about to write, or if you are about to hold a glass, or if you want to do something, okay, and when the tremors are coming, then it is called as essential tremors, okay. So you can say that essential tremors are inherited tremors, okay, and they are can also be called as action tremors, okay. Why? Because when you are going to do some action, these tremors will come, as opposed to resting tremors, which occur during rest, okay. Now, there is something called as intention tremor, okay. Intention tremors. Now, intention tremors are characterized by oscillation at the end of the movement, and they are very typical of cerebellar diseases, right? So what happens in intention tremors is, uh, uh, for example, if you will ask the person to, okay, for example, if you are observing a person, and he's sitting and he's not moving anything, his hands are not moving, so, and he's at rest, fine, right? So, like, how the normal people look like if the person uh, is having tremor at rest, of course that is called as resting tremor. But if the person is normal at rest, but like as soon as you will ask them to do something and he have tremors, they are called as, what you can say, uh, essential tremor, right? So now, if you will ask the person to outstretch the hands and they have tremors, so of course, like, that is physiological tremors, okay. Like essential tremors, they can be suppressed by alcohol. And now, if the person he don't have any tremor while at rest, but you will ask the person that, okay, give me the glass, and when he is going to take the glass, he don't have any tremor, but as soon as he is approaching the glass, and at the end of the movement, uh, the person have the tremor, so that is called as intention tremor, okay. That is what you can say, how the patients of cerebellar patients, they present with, right. And the one of the tremor is called as flapping tremor, which basically occurs in metabolic disturbances. They are also called as Asterixis. They occur in liver failure, they occur in renal failure, right. So, of course, like, whatever I'm talking about, like, you will not find the things over here, right, because I am talking more about, like, from clinical point of view, like, when we examine someone. So resting tremors, which occur at rest; action tremors, which occur when there is voluntary contraction of the muscle, and can be subdivided into posture, present while maintaining a position against gravity, and includes essential tremors, like this, when they are initiating movements; physiological, when you are doing something; cerebellar, dystonic, and drug induced. Or it could be isometric, occurs when with muscle contraction against a rigid stationary object when making a fist, okay. So that is isometric. And kinetic tremors, associated with any voluntary movement that includes intention tremor or classic essential. So it has to be differentiated from resting and intention tremor, and from other forms tremor. So physiological tremor, I told you, which everyone have, even you have. And Parkinson's disease tremors, of course, when we found like resting tremor, we look the other signs and symptoms of Parkinson's disease. And post-stroke, drug-induced causes, drug withdrawal causes, hyperthyroidism also give tremors, cerebellar diseases give tremors, liver and renal failure can give tremors. As I told you, they are called as Asterixis, right? They are also called as flapping tremors. Okay, so now Cerebellar tremor, or the when the person have some sort of cerebellar condition, so you can see a pure or dominant intention tremor at a frequency of less than 5 hertz is a typical of cerebellar tremor. And tremor should be absent at rest but may be associated with posture. Tremor could be unilateral, bilateral, of course, depending on the etiology and drug toxicity and all these things. It is essential to identify other cerebellar signs, as tremor usually occurs in combination with these incerebellar lesions. So, again, like there is a case written over here. Your next patient is in general practice, is a 40-year-old guy, and who has noticed increasing shaking of his hand over the last 3 months, which interferes with his work as motor mechanic. He wants to get some assistance. So your task is to take the history. So why I'm showing you this way, like it's just to make concepts in your mind, like how to take the history of tremor, vomiting, and things like this, right? Uh, so you can see now when we take the history, okay, I will tell you like what are the history points, guys. Uh, like here they are talking more about the physical examination. Okay, so when it comes to the history, uh, remember he have noticed his shaking of hands for the last 3 years and interfere with his work as motor mechanic. Okay, so you have to take the history. So when you know the types of the tremors and the causes of the tremors, so in the history you have to ask all about that. Okay, you'll be looking for all about that. See, in the history, because we know that the tremors can occur in many brain disorders like stroke, like multiple sclerosis, like liver disease, like kidney disease, like neurodegenerative conditions like Parkinsonism, and like the use of certain drugs when someone have taken cocaine or caffeine or SSRIs. Okay, so we have to check all these things. Cerebellar tremors are also known as intention tremors. Okay, this one, or you can see over here. See, intention tremors are also called as cerebellar tremors. Okay, and essential tremors are also called as benign essential tremors, like which run in families. Okay, so let me tell you, if you know these things, then how we take the history of tremors. So you can see over here, we can see how to take history of tremor. Okay, his sorry history for tremors. Okay, so history for tremors, how we can take the history taking of the tremor or history for the tremors. Okay, so same thing which I told you. Okay, you can fit short Sara, you can fit OD para, whatever, like to just remember the things how we take the history of tremor. But whenever we are dealing with anything, okay, of course, like the first thing is we ask about the onset. Okay, when the condition started, duration, for how long, and progression. Either it's becoming worse or better, right? So this thing is, of course, like relieving and aggravating factors. Okay, and associated symptoms. Now, see, like this thing is very, very, very important thing. Why? Because okay, onset. When did it started? The person will say, okay, before 1 year when I had strokes, or you get some clue. 10 days back when I started using some drug like lithium, you get the clue. Duration, progression, either it's becoming bad or worse. For example, someone have tumor. someone have hyperthyroidism. So of course, like the progression will become like the condition will become worse and worse. And relieving an aggravating factor, simply you can remember it like in this way. Uh, the people who have essential tremors, when they use alcohol, their tremors go away. So if the person is saying, whenever I use alcohol, my tremors become better, so it means like the person may have essential tremor and associated symptoms. For example, someone have resting tremor with other features of Parkinsonism. Okay, so we have to ask this thing. So now, of course, like you will ask about uh, when did it started, what time of the day, when you have noticed the tremors are more, when you are going to do something, or when you are going to reach your target, or whenever someone asks you to do that. Okay, so all the things should be taken, right? We always ask for the symmetry of the what you can say tremors. Okay, symmetry. Okay, so ask about the family history. Why? Again, I told you that essential tremors they run in families. Okay, ask about family history. Ask about other movement disorders. Okay, ask about drugs. Ask about alcohol usage or how much alcohol they take. Ask about the signs of hyperthyroidism. Ask about liver or kidney questions. Okay. Ask about neurological symptoms. Okay. So this is a history taking for the tremors, and then of course we go for the examination. In the examination, uh, we simply ask the patient to outstretch their hands, and like we observe, okay, either the tremor are is in the start of the movement. Okay, so you can see over here the examination points. Okay, so see, number one examination point is like you are going to check the general appearance of the patient, right? For example, a well looking man, either he's anxious man. Okay, check the vital signs, check the like is there is any jaundice, any dehydration, how is the BMI. Okay, hyperthyroidism, the BMI will be less. Okay, and then check the hands. Ask the patient, start from the hands. Look for sweating in palms, hyperthyroidism, pulmonary edema. In ENT, like you are going to palpate the thyroid. Look for the signs of chronic liver disease, spider nevi, gynecomastia, ascites, hepatomegaly, and go for the neurological examination, tone, power reflexes, upper limb, lower limb, cerebellar signs, and nystagmus. Okay, and which hand is involved. I would like to know whether postural intention or resting tremors. Okay, so simply like we do examination and just to check like or find the clue what could be the possible cause of this tremors, right? So this is like how we take the history for tremor and we do the examination for the tremors. Okay, though it's a very short topic. Okay, this tremors is very short topic because okay, so like a lot of things, in tremors you are going to understand when we are going to study like the internal medicine. Okay, of course, because you must know the conditions like how they behave. So thank you so much guys for listening.